a very usual question that almost, I think, 9 out of 10 of my patients ask me that, does the pill cause me fat? I mean, that's something every woman gets worried about. Okay, so in recent research and studies, even taken by Oxford, shows that there is no correlation between any sort of contraceptive pills, maybe even implanon, causing increase in body weight. From the most recent, last year, there was a research showing that contraceptive pills increase cancer risk about 7 to 10% in breast and cervical cancer, but it reduces the risk of ovarian and colorectal cancer. So it increases at one side, reduces at another. But at the conclusion of the study, there were still many other areas that need to be checked. For example, there's the woman herself, does she smoke? How is her social life? Is there any risk of cancer from, for example, family risk, genetical risk? So it is still a very grey area, but I would not say it does not. At the same time, I can't say it does. So there's always a little bit risk there. Okay, this is a common myth that I would say. Malaysian women especially believe that as long as they are breastfeeding, they are safe. They will not get pregnant. Breastfeeding is a type of contraceptive, but not an effective one. I've seen a lot of ladies who could not believe that they are pregnant during breastfeeding. So it's not effective. There are many types of contraception. So different types last longer in our body. There is no any data showing that if you take any contraceptive pills, it will reduce your fertility risk in later. It's just that maybe certain method takes longer for it to be excreted from your body. But at the end of the day, you are still able to get pregnant. That is a big no. I've seen myself, many of my patients who get pregnant, because as we all know, most contraceptive methods are 98 to 99%. So you still have the 1% chance of getting pregnant. And I have a few patients who got pregnant during contraceptive pills. So maybe it's fine. Even if you have this 1% chance, you can still be fertile. So above 40, yes, it reduces, but does not mean you will not get pregnant. And I always tell my patients that above 40, you should be more wary of getting pregnant, because if you get pregnant above 40, we call it high risk baby, because the chances of the mother itself getting hypertension, diabetes is very high. So women above 40 should, or it's better for them to take contraception. There's always chances of women taking injectables or implants of missing their period about 2 or 3 times after taking the injection. This is because the change of the hormone level in the body. But most of the times, it goes back normal after 2 or 3 cycles. But there's always a slight risk of that being more delays. But that is when we tell the patients to come back, we do a hormone check and make sure everything is fine. So we don't just, let the patient go. After the injection, okay, you're done, go, no. So we obviously have a follow-up for them. Actually, when you really look at it, you can start trying for pregnancy right after you're stopping your contraceptives. But like I told previously, there's some methods like injectables or implant, the hormones last longer in our body. So it might take them longer to get pregnant. But obviously, if they follow the calendar method, they would know that when they are more fertile, ovulation period, they can try at that time. The chances increases. No, because I've not seen anyone reported to me that while on the pill or anything, they have abortion. There's many reasons of abortion as well. So it's not safe for us to tell that the pills can cause abortion. There's no any studies or data suggesting to it.